According to Chris Hadfield, competence means keeping your head in a crisis, sticking with a task even when it seems hopeless, and improvising good solutions to tough problems when every second counts. Ladies and gentlemen, Cao Shanghao, Ohayo gozaimasu, magandang araw, good morning, good evening, good afternoon to wherever you are in the world. We're pleased to present our research study entitled Level of Clinical Competence in the Delivery Room Among Nursing Students, presented to you by Abalajon, Abello, Apuhin, Arcenas, and Arguillon.
Objectives. The research study aimed to determine the level of clinical competence in the delivery room among nursing students. Specifically, the study sought to answer the following research questions. 1. What is the profile of the nursing students when grouped according to sex, age, and GPA? 2. What is the level of clinical competence of nursing students in terms of skills, attitude, and knowledge? And 3, is there a significant relationship between the level of clinical competence of nursing students in terms of the following aspects and their profile variables: skills, attitude, and knowledge?
Research design. Quantitative descriptive research was utilized. It allows the researcher to study and describe the distribution of one or more variables without regard to any causal or other hypothesis.
Study sample. The population of the study are 273 level 3 nursing students from one of the nursing schools in Bacolod City. The sample size is equal to 162 using Sloven's formula with a 5% margin of error. The researchers utilized the stratified random sampling method.
The instrument used to collect the needed data is a researcher-made survey questionnaire. It consists of two major parts. These parts are as follows. Part 1, the participant's profile, and Part 2, the level of clinical competence in the delivery room among nursing students, with 19 questions adapted from Miller's pyramid model. In the first section of the researcher's questionnaire, sex, age, and GPA questions establish a participant's personal profile. A profile sheet was attached to the instrument. The second part consists of a Likert scale survey questions. These responses are offered in the form of a 5-point scale. The instrument obtained a validity score of 4.9 and a reliability score of 0.924. Now for the results of the study. The demographic data of the student nurses was determined using the frequency distribution and percentage in accordance with sex, age, and grade point average. The results depict that the female participants outnumbered the male with a percentage of 79.6%, level 3 female nursing students. In terms of age, most of the students are aged 21 years old with a percentage of 75.3%. In terms of GPA, most of the nursing students obtained a grade point average of 2 to 1.6, displaying a percentage of 61.1%.
Level of clinical competence of nursing students in terms of skills. The results revealed a mean of 3.34 with a standard deviation of 1.09, which indicates that the majority of the students are competent with regards to their skills in the delivery room.
Level of clinical competence of the nursing student in terms of knowledge. The results revealed a mean of 4.08 and a standard deviation of 0.58, interpreted as a high level of competence. The third item from the questionnaire, I am able to identify the normal values of vital signs, got the highest mean score of 4.60 and a standard deviation of 0.60.
For the level of clinical competence in terms of attitude, the results revealed a mean of 4.44 with a standard deviation of 0.70. Majority of the students has a high level of competency with regards to their attitude in the delivery room.
There is no significant relationship between the level of clinical competence of nursing students in terms of the following aspects and their profile variables: student skills, students' knowledge, and students' attitude. Conclusion. The level of clinical competence in the delivery room among nursing students when grouped according to skills, the nursing students' overall performance is competent. In terms of the student's attitude, it shows that there is a high level of clinical competence. Moreover, when grouped according to knowledge, it shows that the nursing students have a high competence score. However, it shows that when they are grouped according to the nursing students' skills, attitude, and knowledge, and profile variables, there is no significant relationship between the level of clinical competence.
Based on the gathered data regarding on the level of clinical competence in the delivery room among nursing students, the following recommendations have been made by the researchers for the enhancement of the study. To the nursing school administrators, given that the nursing students are competent in the delivery room in terms of skills when compared to the attitude and knowledge where the nursing students have a high level of competency, the researchers recommend to allocate more clinical exposures to the nursing student to enhance their nursing skills in the delivery room. To the clinical instructors, the researchers recommend to effectively deliver the course to the students and modify their teaching style so that the students can acquire the knowledge and skills necessary for delivery room exposure. To the nursing students, the researchers recommend developing themselves and determine ways in which might do so in order to strengthen their clinical competence in the delivery room in terms of their skills. For the knowledge and attitude, the nursing student should exert more effort in order to enhance the level of competency. To the future researchers, the researchers recommend to determine other variables that affect the level of competence of nursing students in the delivery room. The future researchers may benefit in utilizing this study that may serve as reference material to understand further the data related to the study.
To find our references, you may scan the QR code located at the lower right of the poster. We hope that you were able to learn and understand something new from our study. And for that, we are thankful for taking your time in watching our presentation. Arigatou gozaimasu. Salamat po. Thank you and God bless.